Something that we get asked a lot about is joint irritation inside the shoulder. And what typically happens in individuals who have joint irritation inside the shoulder is what we call an activated arthrosis or an acute synovitis. What has happened is the joint capsule has become irritated and you start to have some pain as well as range of motion loss. Now I'm going to show here on the board what that looks like, what structure is being affected. This is not a rotator cuff tear or a bursal injury. We hear sometimes you'll have a subacromial bursitis. Those can come along with this and can be secondary or primary to synovitis, but typically they present a little bit differently. And I'll go over that. But what we want to talk about is a joint capsule irritation. A severe joint capsule irritation can often lead to a fibrotic component of it. You've probably heard of a frozen shoulder. That would be a very severe form of this. When you have joint capsule irritation, what typically happens is that you lose range of motion in certain areas. So for example, in the shoulder, you'll lose range of motion in external rotation. If you put your arm out like this, and it's difficult to fully rotate your arm out. It's difficult to bring your arm up to the side, like in a jumping jack position. And typically the most difficult one is putting hands behind your back. And so with our female individuals who come in with shoulder pain, and they often complain about reaching behind their back to undo their bra, it's usually a key sign of a joint capsule irritation. We treat it and the range of motion comes back, but that is often a key sign is it's getting into this internal rotation component and it's really painful. So what's going on here is I'm going to draw the back side of a shoulder. First we have the shoulder blade. It looks a little bit like that. We have the spine of the scapula, the spine of the shoulder blade here. We have the inferior angle, and then right here would be the spine. Now, most people don't realize this, but your arm, your humerus, is actually attached via the shoulder blade. So I'm going to draw that here. Very rudimentary, as you can see. It looks like that. Now, what keeps it together? Underneath the rotator cuff, and I'll draw the rotator cuff, is that you have a joint capsule. It looks a little bit like that. It runs across here, as so. It looks a little bit like that, and it holds it together. Each joint in our body has a capsule that keeps it together. The innermost lining of the joint capsule creates what we call synovium, synovial fluid. The inner lining is called the synovium, and so that allows lubrication and for like a nice, easy movement. But when it gets jammed or irritated by falling or by catching, a snatch or a clean and jerk wrong, or getting pulled, you can get really irritation of that joint capsule, and really the innermost lining called the synovium, and then you get that range of motion loss. Oftentimes we have the rotator cuff to help protect that. I'm going to draw that here. We have our infraspinatus, meaning infra below the spine. Our teres minor sits right there. We have the supraspinatus that runs right there. And then on the front side of the shoulder blade, we would have another one called the subscapularis. So they all look like that. So they help control the shoulder and keep everything moving really well. A lot of times if you have a rotator cuff irritation or whatnot, you just are more prone to a synovitis because you have less control. And so a lot of times when we treat the synovitis, we'll have a rotator cuff myopathy, tendinopathy, or tear afterwards, and we have to treat that for your symptoms to fully resolve. But typically, this is the biggest issue. So if you're having problems externally rotating, abducting, and putting your hand behind your back, that is a huge key sign that you have a synovitis. So you can always test side to side, and that becomes more difficult then we're thinking that. There are other tests to help rule in and rule out rotator cuff versus a synovitis versus a bursa, but these are key signs that we see for the shoulder. If you have any questions or concerns, always feel free to reach out and send us a message. Remember, no pain, more gains.